everyone, I'm Leslie Carranza. I am one of the OB/GYN faculty, and I know that we have capstone coming up next week, and we're not all able to come for the dry run just because of scheduling. The most important thing, I just wanted to have a chance to explain to you what's going to happen next week. We are going to be running 3 obstetrical scenarios, and I know this is very new for some folks, so I just wanted an opportunity to explain to you what the Parto-Pants are, which are actually in Spanish, parto means birthing, and we just wanted to show you very quickly how it actually works, and it hopefully will make more sense. We are going to have a patient actor that's going to be wearing these pants, and they are scrubs that have been modified to be able to allow for a birthing process. So these are fairly big, but as you can see, there's been a modification that has been made, and this is actually softer cloth that is the vagina. There's actually a hole right here for a urethra where you can place a Foley catheter, which is very important in the setting of basically uterine atony. You always want to drain the bladder if you think somebody has a boggy or soft uterus. There is also actually a rectum where you can dispense tablets such as Cytotec to also help with uterine contractions. You may also notice that there are these additional attachments, and this is what is going to allow for us to plug in the tubing that will actually bleed. The patient actor will actually be will have the ability to control the amount of bleeding with these controllers, and it will be at their hands. So where this is placed, we are going to have 2 sources of bleeding. There's a larger bag that goes on the actor's chest, and then this one right here gets placed on a special pouch that is in here inside the Parto-Pants. And just to quickly demonstrate, this tubing is going to come through here, and then it gets attached right here. And as you probably can see now, the actor has the control the entire time of how much bleeding there's going to be. There will be a faculty member that is going to be present in the room during the simulations. They are going to have a whiteboard where they're going to be writing instructions for the actor, and there's hand signals that will take place that only the student actor will know, or the patient actor will know. So there's a lot of preparation that goes into using the Parto-Pants and having our patient actor. Just some other minor things for you guys to be aware of. When we are teaching the students to do fundal massage, which is where you actually have to massage the uterus to help improve tone, we have this special attachment here in the Parto-Pants, which is hard, which is going to simulate the pubic symphysis. So when our students are going to be looking for the uterus, whether it's boggy or has tone, they'll be able to feel right above it. And what's going to happen is the patient actor will have their hands right underneath here, and if the students can feel a fist, they'll know there's uterine tone. If they just feel the bag, they'll know that that is actually a uterus that is boggy. We will be going through all of these instructions with the students. We just wanted you as an instructor to have some idea of how this is going to work ahead of time. Finally, you're probably wondering how we're having a baby deliver. This is the baby, and that's the placenta. It's very easy to detach, and the students will be shown how to do this. And just to show you how this is going to work, the baby and the placenta will be on the patient's belly, and she will also have the ability to control when the baby comes out. So as you can envision, she has her hands right in front, and she determines when the baby gets delivered or not. This is actually a great way to also be able to simulate shoulder dystocias or retained placentas, because as you can imagine, as the baby comes out, you can also tell the instructor detaching the umbilical cord to have a retained placenta. So as the students are trying to pull, you can tell your patient actor to hold on to the placenta. For our scenarios that are happening on June 1st, we will not be doing that. The scenarios that we're going to have are 3. The first one is a precipitous delivery. The second one is going to be a mild postpartum hemorrhage. And the third scenario is going to be, again, a postpartum hemorrhage, both of those due to atony. And in the third scenario, we've implanted some errors to see if our students catch them and see we can test their teamwork. So I think, oh, and one last thing before I forget, in OB, especially with hemorrhage, there's a lot of intramuscular medications that are given. So our patient actor will actually have this taped to their leg, and they can safely have intramuscular injections given right here. They will also have fake IVs with medications will be given through their IVs as well. If you have any questions, concerns, my email is available to you, and I hope this video turns out to be helpful for you guys. Looking forward to working with you guys on June 1st. Thank you.